can look at this individual particle number testing. A common form of this is called the NMR lipoprofile. There's also called the ApoB, which is the actual protein that carries the low-density lipoprotein that carries the cholesterol through the body. That's pros and cons of those. There's inflammatory markers that we talked about, hsCRP and LPPLA2. There's lipoprotein A. This is a fatty protein that attaches to these LDL particles. It's inherited. 20 to 30% of people have this, more commonly in Northern European background. If you have this, it encourages plaque formation. And also if there's that plaque rupture that occurs where the clot starts to form, this interferes with the body's natural clotting breakdown process. You also can pick up calcium, as far as screening for heart disease, calcium in the arteries. That's commonly known in a heart scan. That's not recommended for everybody. People who are at high risk probably don't need this. It's more often recommended for people who are in the middle range. We're not sure. This may make us more aggressive. There's another test called a CIMT, known as the carotid intermedial thickness test. It measures plaque in the lining of the artery. If you have plaque there, it means that there is a high chance you're going to have plaque in other arteries going to your brain or in your heart. It's an easy way to access it. There's pros and cons between the two, but there are other tools you can use to see if you're at greater risk. Now we look back at Fred. Why did he already have plaque in the arteries? Well, we got some more information. We look at his total cholesterol is 169, but he had an LDL of 113, well in the normal range. But he had a very low HDL, 30. Was very low, less than 40 for men is considered very low, less than 50 for women. His particle number was a little over 2,000. He had an HS, which is extremely high. We would have expected his particle number to have been close to about 1,100. This 2,000 is in the very, very high range. His hsCRP stands for high sensitivity C-reactive protein, was 2.0. That's high, especially for a 33-year-old. His lipoprotein A is 75, less than 30 is considered normal. So he had that. He also had family history of heart disease. Calcium was found in the heart scan on top of that, showing him to be the 98th percentile for his age. His gold particle number being at high risk was between 700 and 1,000, so well above that. This patient actually is me. That's how I got very interested in heart disease, is when I found out that I had all these things. The cards were flipping up. I had that particle number done, found out I was very high risk, found out that, hey, there were limitations. Me as an individual would have been shown I was at very low risk. With super premium on my life insurance, very low risk overall, but I already had plaque buildup in the arteries, and if gone unchecked, would have likely developed a heart event in my future in life. Fortunately, through both intensified lifestyle changes, the plaque is likely to be reversed. Eating a heart-healthy diet, the HSC reactive protein measure of inflammation, that has gone down. Particle number is down into the 500 to 700 range, so everything is doing very well. So part of that is carrying this over to you. Don't wait to be valued. We talk about by the time you have an event, and it may be too late. 1 out of 6 people have a heart attack, die from a heart arrhythmia. 5 out of 6 people survive, but the stakes are very high. Make changes in your lifestyle to help prevent heart disease, diabetes, and high blood pressure. What can we do from a non-medication standpoint? Number one, if you smoke, there's probably nothing that we can do that's more effective, one single thing more effective than quitting smoking. Within a year, it cuts your risk of a heart event by 50%. Just walking for 30 minutes, 5 days a week lowers your risk by about 25%. People think, I gotta sweat. If I don't exercise, if I'm not sweating when I exercise, there's no benefit. Actually, the biggest benefit is if you go from being sedentary, meaning you hardly do anything, to just walking for 30 minutes. Or whatever you like to do. If you can't walk because of knees, ankles, or arthritis, swimming or biking. Something to be active. Talking about diet and weight loss. Also, there's medications for treating cholesterol have been shown to have a significant reduction in heart disease. The more these work together, the better. Tell my patients it's not, okay, if I put you on this cholesterol medicine, that means that you don't exercise, I can sit there and eat whatever I want. And at the same time, hey, I've been exercising, doc, how come my cholesterol? Well, we know a big part of it is genetic, and in fact, the majority of it is genetic, but there are significant changes in your lifestyle, especially if you have more room for improvement, especially if you have more weight to lose, especially if you're very sedentary. Talking about blood pressure control, that's extremely important as well. When we look at blood pressure, going back here, blood pressure is, if that, in a simple level, if that doubled your risk, granted, the higher your blood pressure, the higher your risk, But again, if we looked at your cholesterol separately, if somebody had cholesterol, say that doubled the risk in a person. Combined, you say, hey, there's 4 times the risk, but actually it ends up being often 8, 10, 12 times the risk, because when they work together, they work synergistically in a negative way, that increase your risk of developing plaque in the arteries. Metabolic syndrome. Syndrome, by the way, is just a name, medically speaking, for a group of symptoms that, when present, increase the risk of developing plaque in the arteries. Before we knew HIV caused AIDS, and we knew there were certain people who were getting diseases that have a weakened immune system, we found out, hey, this was HIV. What are the things with metabolic syndrome? People who have metabolic syndrome are at greater risk of developing diabetes, greater risk of having a heart event or stroke. And most of this has to do with the complex control of energy in our body, the fats which are used for energy, as well as, which is the triglyceride, cholesterol, and as well as glucose and control of glucose, leading often to higher LDL particles, lower amount of the HDL. 5 characteristics of this, 5 criteria. Waist circumference for men, over 40 inches. This is measuring at an inch above the hip bone, standing up. It's not measuring where you wear your pants. Over 35 inches for women. Triglyceride level greater than 150, blood glucose level greater than 100, and blood pressure greater than 130 over 85, and HDL less than 40 and less than 50 for men. The more of these you have, the worse off. Technically, for the diagnosis, you need 3 of the 5 criteria. Metabolic syndrome, again, increases risk of heart disease, more dense small LDL particles. Treatment, well, if you have this, we know that people can prevent from developing diabetes by losing weight loss. Often just 5 to 7% of weight loss can make a marked improvement. And if you know this, hey, I'm at risk for developing diabetes, even though I don't have it now, I'm going to make the changes now before I develop diabetes if I can. And that's through diet and exercise, weight loss. Looking at exercise, one of the original studies, their first studies looking at what the effect of exercise can be, was done in around 1949, published in Lancet. They looked at the bus drivers and the ticket takers of these double-decker buses. Now you may think, hey, I want the easy job, I want to be sitting the whole time, I don't want to be running up and down the stairs grabbing tickets from everybody on my feet all day being exhausted. Well, it turned out there's a little over 40% lower risk of having a heart attack in those who actually were the ticket takers going up and down walking all day compared to the bus drivers. We know other studies show that as well when it comes to exercise benefits. All diets work when we talk about weight loss. Number 1 predictor is how well someone sticks to the diet. So when I look at a diet, it's not meant to be a short-time thing. This is meant to be a long-term thing. On a simple level, I say a whole foods, mostly plant-based diet, meaning having lots of fruits and vegetables, whole grains, less refined food. The fiber, like we filled this up, helps lower the cholesterol a little bit as well. Not talking about whole foods by mean eating at necessarily the store, but also not necessarily eating the whole pizza. We're talking about just eating whole grains, lots of fruits and vegetables, filling up on that. It's hard to overeat. Talking about cutting back on calories. In the end, all the diet's trying to cut back on calories. What's nice about the technology we have available today, there's different resources we can use. There's examples like myfitnesspal.com, among others, that are free. The Lose It applications, Weight Watchers, they allow you to track your calories based on how much you need. Somebody who's 6'3", 220 pounds is going to need more calories than somebody who's 5 foot, 110 calories. One size does not fit all. And then talking about high quality calories, eating not just the calories, but hey, there's benefits. A carrot may have hundreds of vital nutrients that you can't get just from taking a vitamin. So eat those, and they're also less calories per volume. You know, 2 cups of carrots may be 100 calories. 2 cups of potato salad could be 200 or about 1,000 calories. So looking at the quality of the calories as well. What's also exciting about all this is plaque can be reversed. People say, hey,